Go for it.
Good morning, everyone. Thanks for joining today. We are going to do some different things today and try some different things with technology. I hope that you guys out in the field are doing the same as you're trying to do your daily work, is explore technology and use it in a different way that you haven't used it before. So we're going to try some things. It might be a little bumpy, but we're going to get through it. And so just be somewhat patient with us. Good morning. And again, thanks for joining. I know you guys are busy out there in the field and have a lot of things that you're going to need to be getting done. So I appreciate you taking time to join myself. Becky Dunnigan is in the room. Oh, hold on a second. We're already having technology issues.
No, it's feedback because of speakers.
Are we good? Yeah, you're on mute. Okay. So I have in the room with me Becky Dunnigan, but we are social distancing, so she's kind of behind the computer that you see, and she'll be joining me and probably adding input as we go along. Just to kind of give a quick run through the agenda, we have some housekeeping items that I want to go over that are short and sweet. We pulled the data again that we went through last week, so we're going to touch on that and talk more about safe measures. And then we're going to, and before we get to that, we're going to hear from some field staff. So let's get started. At the end, if we have time for questions, you know, I'm always up for taking questions. I love hearing from you guys. And if I don't have answers, we will try and connect back with you and get some answers. So first on housekeeping items. One of the things that will be coming out via email today, and it may have already come, I'm not really sure. I haven't been able to keep up with the emails in the last 30 minutes, but is a questionnaire that is related to technology. So hopefully you are hearing from your local courts and they are setting up Zoom hearings for your court hearings, because we know we are in this new normal, and new normal means that we have court hearings and hopefully they're happening via Zoom, and the court is lead on organizing those. Well, one of the things that we need to hear from you guys is we really need to know specifics about what technology our clients have, because we want to help support the courts and you guys and make sure that clients are available for court hearings. And so we're exploring different ideas and ways that we can support y'all and support the court. So it's 5 questions. It's super short. It's really important that we hear from the frontline staff who are working directly with the client. So if you're a family service worker, a program assistant, please take time and answer these 5 questions. It will really help us, help you, and help our clients. The other thing is Kristen Harper has gotten, and Crystal Jones have gotten a lot of questions related to prom and graduation for our seniors. And so messaging will come out with specific instructions about prom and graduation. So if you're involved in TYS or have kids on your load that are in the TYS program, please make sure that you're looking for that guidance that will be coming out. Also, I know that you all are want to know more about PPE, personal protective equipment. And thank you to everybody who is involved in getting us the daily feedback on where you are with your PPE. We want to support you. We are advocating strongly to continue to get PPE. So that's really important. I don't know how many times the information that's collected from the field, we put in an Excel spreadsheet, and we are sharing as much as possible with everybody who's trying to get us PPE. And I can tell you there are a lot around the state and leadership that are trying to explore, not only explore ways through ADAM to get us on the priority list for PPE, but we also have some community partners that are out there advocating and trying to reach out to companies to get us PPE. So the information that you give us on a daily basis is critical so that we can continue to advocate. We will also be sending out a message related to face cloth masks. So hopefully you heard from the governor earlier this week or over the weekend, I'm losing track of days, that the CDC is now advising that if you are going to be out in public, that you at least have some kind of cloth covering, not necessarily a mask, but a cloth covering. And they even put out a pattern on how to make a cloth mask. And so we, Amy Webb down at DHS has put together a message that you can send to your community partners, because there's a lot of community partners out there, and maybe not the ones that you're typically using, maybe church, maybe a ladies group at your church that are getting to get, well, hopefully not getting together, but using their group to start making cloth masks. So this is a message that you could share with anybody in your community, asking them to make cloth masks for you and your workers, and gives them the link to the pattern. And so we want to encourage you to reach out to your community partners and see if anybody's willing. And I've already heard from some areas. We'll hear from area 2 that they had a partner step up, and I know White County had a partner that stepped up related to cloth masks. So that is definitely in the something that you can do at your local level, and reach out to your community and ask if they can help with cloth masks. But that does not mean that we're not going to continue to advocate for PPE and the cloth mask and the gloves and the needs there. So please don't take it like that. This is just in addition to what we're doing to try and get additional PPE out to the county offices. Becky, do you want to comment anything on that particular issue? Because I know you're a lead with our PPE.
The only other thing I would add on the PPE is we had gotten some gallon jugs that should be here hopefully any day. And what we're going to do to refill your small bottles of hand sanitizer, we're going to get gallon jugs out to the different counties. So we're working with procurement to get 3 more 5-gallon buckets of hand sanitizer, and we have a group here in central office that's been filling those and delivering those. So what we'll do is deliver them in gallon jugs so you can refill the small bottles. So keep your small bottle hand sanitizer, because as it runs out, there will be gallon jugs in your county offices to refill those.
Okay, so and then one last housekeeping item. We really need you guys to help us with keying placement. So please make sure, and I know we usually just ask once a month, but we need to know where our kids are. It's always important, and I can't understate that. But right now, we need you to have your placements keyed. So if you are working remotely, that is something that you can do via Chris. If you are not sure, please check and make sure that every kid on your caseload is keyed where they actually are. I cannot tell you how important that is as we continue to support our foster and relatives, that we are able to pull accurate data about where our kids are. So please make that a priority and key your placement. Okay, so follow up from last week. We set this DCFS Zoom on to really follow up on our new normal and our focus on safety and permanency. And so I know that many of you were kind of shocked by the data. I'm not gonna lie, I was a little shocked last week. And so, but it's important for us to manage our workload by looking not only, we know that there's a kid behind every number, but for management at every level down to that local caseworker, really looking at the data and seeing what we're doing. So what we have decided, because we heard from you guys that there are keying issues and maybe your data wasn't exactly right, and we get that, but it's somewhat close, and you have a responsibility to put things into a case management system, especially as we're getting into this new normal. And so we're gonna pull the data every Tuesday. So that really gives the areas that focus on keying on Fridays and Monday an opportunity to key before we pull it on Tuesday. Now, even though we've done that, Becky's going to talk to you about safe measures. We cannot push safe measures enough. Safe measures is a great way to get this data. It's updated nightly, and you can see it every single day on your own. Most of this data, you can compare it to prior history. And so Becky's going to walk through that here in a minute. And we're going to make some things more available to you as far as training if you need a little bit of extra to use safe measures. But safe measures is truly key to seeing from the worker level all the way up to area director and all the way up to me as to see what is going on in your area. So I'm going to start, you got a few minutes ago all the data that I'm going to talk through, and I would love to really start with the most positive, but our priorities, and I sent out the triage recommendation, is really to make sure that kids are safe and to ensure that we're moving children through the system to move to permanency, because no child should be raised by state government. Foster care was really meant to be a short-term intervention and get kids to permanency. And when we are not able to really work towards permanency, that means that we have kids being raised by the state. And even though I'm really proud and you guys are doing an amazing job, you know that that's not what's best for kids. So before we dig into the data, I wanted y'all to hear from some of our local staff who are doing some amazing work. Because about a week ago, and before I turn it over to them completely, I want to share with you something that happened about a week ago, give or take a day. I was contacted that that the governor wanted to feature the work that you guys are doing, because it is truly amazing, and asked for some additional stories. So hopefully you saw the press conference that Keisha Smith, Deputy Director, she did highlight the work that y'all are doing to ensure that kids are safe. And so because like things happen, there was a short time frame. I just pulled up the DCFS cell phone list and started calling a few people that I know to ask about the work that they were doing. And so I want to applaud those people that took my call. And then also I was so encouraged and inspired by the work that they shared with me. So Kim Sewell and Krista from Hot Spring County, Tina Jordan, Rachel Spites from down in Area 4. They all shared multiple stories with me of the work that they're doing in their area. And it was really encouraging for me to hear, but it also really told me about the amazing staff that we have across the state who are ensuring that kids are safe while also protecting their own families and their own health and safety at the same time. So I just want to give a shout out to those individuals who took my call, and I'm so proud of the work that you guys are doing in your counties. Also, I would like to give a shout out to Laura Rogers and Stephanie Beasley and Angie out there, or Angela in Faulkner County. They had a very significant placement issue over the last few days and have just done an amazing job to step up and drove late at night to try and calm a child down and stood there. And I know that this work is happening across the state, but these are just some things that have come across my plate, and I felt like this is a good opportunity to give us some shout outs. Like, it is truly amazing to see the work that y'all are doing, and I know that you're committed to the children and families across the state. So thank you so much. So we've arranged for a couple of different people to share some work that they're doing in their area. So we're going to start with Felicia Price and Megan Potts from Area 2. Now, let me just also say that Area 2, including Sebastian County, as I looked at the data, they are rocking it on initiations. They are rocking it on foster home visits, on DR. And so they are really in-home visits. I mean, applause to Sebastian and to all of Area 2 for the work that you guys are doing. Your numbers, and you know, like, again, your numbers are impressive, but they equate to individual kids. So I think that we have shared, no, it's not on yet. This is where we might have technology issues. Megan's on because I can hear her. Megan, can you say hello just so I know that the technology's working?
Hi, everyone.
Okay, great. Can you also unmute Felicia Price?
Yeah, she is.
Okay, Felicia, can we hear you too? Can you say hello? Felicia? Was that you, Megan, or was that Felicia?
I have not heard
I'm not hearing Felicia.
She's unmuted.
She's unmuted. I wonder if Felicia has a phone, if that's the problem.
That might be.
Can you hear me?
Oh, okay, good. Is that Felicia talking?
Yes, ma'am. I'm
Okay.
sorry. As soon as it was ready to go, my internet stopped working.
Okay. So this is our first time. I'm in Little Rock. They're in, I think, are you both in Sebastian County somewhere?
Yes, we're both in Sebastian County.
Now, I'm a lawyer and I know better than to ask a question I don't know the answer to. I'm going to do it anyway. So are either of you working remotely today?
I am.
Okay, great. Great. Felicia, are you at the office or are you working remotely?
Might have lost her
She lost her video.
internet. She said she was having trouble. So she's
Oh,
probably
okay.
at home.
Okay, well, that's good. Okay, so we may have some back and forth with Felicia. I think she may be having internet issues. So Megan, I know that y'all have both talked, and so you might have to help us out on this one. So we've asked you two to join us today to share some of the ways that you and your team in Sebastian are continuing to do the great engagement and investigation work in Sebastian County while still keeping yourself safe. And Megan is the somewhat new, even though she's been with us, supervising investigations. Many of you probably know Keith Fortson, who was with us for a long time. He's since retired. So Megan, can you share some of the basics that y'all been doing to keep everyone safe and healthy while your team is conducting investigations?
Absolutely. So first and foremost, we are definitely using using the triage guidelines that you helped provide us with. So thank you for that. That's definitely helping a lot. Definitely the PPE, wearing those goggles, gloves, mask is definitely helping. My team, I know, is also asking those questions out in the field. If anyone's sick, showing symptoms, if they are. We've had a lot of luck, like bringing the children to the door to assess their safety that way. If the family has access to, say, FaceTime, things like that, we're able to complete walkthroughs of the home that way instead of having to enter the home. So all of those things have helped us a great deal in our workers feeling safe and keeping our clients safe.
Thanks, Megan. Also, you know, I'm gonna go off script a little bit, but how are you getting families to engage with you to answer those questions? I know initially some people had concerns that families wouldn't be truthful or they wouldn't answer the questions. What are the tactics that you're using to really engage with families and get them to work with you?
From what I'm hearing from my staff out there in the field, I feel like for the most part, they haven't had issues. If anything, I think our clients respect that we're asking those questions, and it helps put their guards down, that their safety is important to us as well, their family, and not wanting to get them sick either. I know they have had concerns, you know, they don't want us bringing germs into their home either. But once put down and they understand that we care about that, it seems to have helped a lot.
So I know, and I kind of already mentioned this, you're one of the areas that a community partner started making masks for you and your staff. Can you tell me a little bit more about that?
Sure. So I just kind of started putting on my own Facebook, just, you know, asking if anyone's bored out there as the growing trend started with the fabric mask. And Miss Karen Phillips with Restore Hope has been amazing, and she stepped up to that call immediately and provided us with several masks for the prevention team to start with, and that was including protective services. We more for every other worker, and I later found out that those were actually made by the home ec teacher at a local school, so that was really cool to hear.
Oh, that's cool. Last night I got a picture related to Lowe's in your area. Do you know about that? Again, I'm going off script.
Yeah, so Lowe's actually donated a large amount of cleaning supplies to help our families in need at this time. So I know we had a huge crew at the office helping unload that stuff and get everything put away so it's available for our clients.
So how did that come about, Megan? Do you know, like, how did Lowe's know that you guys were in need?
I don't know exactly who got that one going, so I hate to give credit to the wrong person or not the right person, if you will, but kudos to whoever got that done, because that was huge for our families.
Yeah, I mean, it was a picture of a lot of bleach and paper towels and all kinds of good stuff is what it looked like.
Yes.
Okay, that's awesome. So, Felicia, how's the internet going? Can you hear, or try and see if we can hear you? Can you do a test?
Yes, can you hear me? This is Felicia.
Okay. Oh, okay, great. So, Felicia, you're an investigator now, right?
Yes, ma'am.
And you've been going out and initiating investigations?
Yes.
So can you tell me some of the things that you're doing and that the team has come up with to help make things easier in the field?
Yes, I've actually left a bag in my trunk with an empty folder and the folders and things I normally need out in the field. It's kind of like a grab and go. If I remember to bring everything with me, I obviously don't waste the family's time, plus it limits my unnecessary contact. This helps me and the family in the short term and long run because they see me being prepared and respectful of their time and health as well. Also, go ahead.
No, go ahead. You're doing good.
Yes. Also, that prepares me out in the field, and as well as getting the emails and the triggers of getting a new referral. Megan also calls us and lets us know that we have that. So it gets a little crazy sometimes out there. So that extra reminder is much appreciated. We also have a few workers that are quarantined, and so they're not able to go out into the field. but they are able to give me information by email about the family before I go into the home. So they're able to email me and look up such as things, red flags, CRIS history, criminal history, and that's pretty much ready for me as soon as the referral hits the inbox. This has helped me feel super prepared for the initial contact and has made things go so much smoother. So pretty much when a referral comes in the inbox, we have great communication allowing us to just go out there as soon as we get the referral.
Yeah, and Felicia, I love, when I heard about this idea, I love this idea because, you know, we do have staff across the state who are at risk and therefore they're not making initiations, but they're still working remotely. So these really detailed CRIS histories and making sure that they understand, helping you understand what the prior history is and maybe even digging into unsubstantiated, that's a great use of their time and really gets you prepared for the actual initiation. And hopefully also determining whether there's a true safety factor that you might need to call law enforcement to assist you if you really get a good history on the family. So I love to hear that y'all were getting creative and working as a team and maximizing your resources. Can you tell me a little bit more about these folders and the grab and go? That sounded really interesting.
Actually, yes. I keep everything in my trunk. I also have in my bag my supervisor, my co-worker, my office mate has been great about informing me that I've always needed one. I have gloves, masks, and I also have the fabric mask. Can you hear me?
Yeah, you're breaking up just a little bit.
I'm sorry, can you hear me?
Yeah, I can hear you, but you're breaking up a little bit.
Okay.
Felicia, I think you're breaking up a little too much. Hey, Felicia. Felicia, can you hear me? Because I think you're breaking up, so I think we're gonna have to go back to Megan. So sorry. I'm gonna mute her for a second. Hey, I had to mute Felicia because I don't think she can understand me either. We may be froze up. So Felicia, if you can hear me, I'm really sorry. I muted you because we were having technology issues. But thank you, Felicia, for sharing that. Megan, just to go back to you, is there anything else that maybe Felicia didn't share? Or anything else that you want to share with the DCFS?
I think a lot, what she was trying to explain is just having all of her necessary forms, medical passports, everything she would need to create an investigation file pretty much already with her. I know a lot of our team does that anyways, even without this pandemic going on, just so they're always ready and grab and go, as Felicia termed that.
Okay, I love it. I'm so impressed with the work that y'all are doing, and thank you guys for being willing to share on this Zoom. I know it can be a little bit nerve-wracking to know that all of DCFS is listening to you. So thank you both. Let us know if you need anything. I'll see you guys. We're gonna go to our next area. We're gonna go to our next area, which is Quita. Apparently I don't have my printout. So Quita, you're next.
Hello, can you hear me?
Hey, Quita.
Hi.
Yes. Yeah, and thank you for sharing your video with us so much. I have somehow got all these printouts here, and I don't have our printout of our conversation, but so we're gonna wing it. But we got this, okay?
All right.
So tell us a little bit about the work that you're doing in your county.
Well, we're pretty much doing the same things that they spoke about. We're paying really close attention to the triage recommendations, asking the questions of the clients, just case-specific decisions on how to balance the need to see kids and families face-to-face to ensure their safety.
Okay, 1 second. I got this. When you don't have your laptop, you just use your iPhone. Look at me, just making it happen with some technology. So you're in Ouachita County, right?
Right.
And I also noted that when looking at the data, Ouachita County was looking really good too. Yes. So great job to the whole team there in Ouachita County. So So communication is so important, even under normal circumstances. Have you guys made changes to how you communicate to make sure that everybody is safe and appropriate?
Yes, we have just informal meetings every morning to talk about the cases and who needs to be seen, what needs to be done, passed, things like that. So just to make sure that we're getting things done.
Yeah, and how are the supervisors making sure that they have good communication with the workers?
The supervisors in Area 4? Well, we
Or
get
just in
together.
Washington County?
Oh, well, I'm the only supervisor in Washington County. So, you know, basically I just meet with the staff daily. I have an open door policy. We come in, talk about court. Really excited about having Zoom for court hearings. Makes it a little bit less stressful.
Tell us more about that. Have y'all actually had a Zoom hearing at court for court yet, or is it coming together?
We had one for our probable cause Monday, and it went really well. We're scheduled to have a normal court day next Wednesday, and they'll all be done by Zoom.
Okay, that's great. What about, there again, I'm going off script, so who knows what the answer is going to be. I get that. But what about the clients? How are they? I mean, there's just been like rumblings of, will clients really be able to Zoom? How will the courts get them involved in the Zoom? How are y'all handling that in your area?
Well, our clients now, I mean, they're using Zoom for visitation. So that hasn't been a problem. I don't anticipate it being a problem for court.
And, you know, there was a lot of questions on whether clients would actually use Zoom on their phone or if they had phones. So y'all have made that work with visitations. Tell us about that.
Well, usually the caseworker will facilitate the visit. They'll invite the client and, of course, the foster parents for the visit, for the Zoom call. And it's been working really well. Now, of course, the parents haven't wanted to stay on the call long. I think the longest we've had was an hour.
Oh, that's still pretty. I thought you were about to say like 5 minutes. So that's still pretty good. And the foster parents in your area are engaging too on the Zoom. So that's good to hear.
Yes.
Have you had to do anything special to get either foster or bio parents on board, or is everybody just kind of working together and know that this is our new normal?
They're working together. It seems to be working better than the way it used to. So I'm really pleased about that.
Okay, last question. One of the new ways that y'all are tracking your work is really using safe measures. Tell me a little bit more about how you're using safe measures to help families and help yourselves keep focused during this time.
Well, safe measures, I mean, I use it as a tracking tool as everyone else does, I'm assuming, but it's really good for the case plans, the staffings, making sure the clients are getting what they need, their monthly visits, weekly visits. It's really helping.
Have you found it pretty
all there together? I'm sorry.
Oh, no. I was just going to ask you, have you found that it's easier than just seeing the ticklers or using CRISNet reports? Have you found safe measures easier to use?
Yeah, I think it's a lot easier because it's all there together. I don't have to go to different reports. So it's a lot easier.
Well, Quita, thank you to you and your staff in Washita County for everything you're doing. And thank you for being willing to join us on the Zoom today.
Thank you.
Okay. So guys, thanks for hanging with us as we heard from staff. If you have other great things that you think that you're doing, ideas that you're have implemented in your area, your county to get the work done that you think would be good to share with DCFS all, please send those to me, send those to Keith Metz. We would love to learn from you, and we would love the opportunity to share with staff across the state so that we can all learn from each other. And this was our first time to try and use technology to share across DCFS. So we had a little bump, but overall it went pretty well. So we'll continue to work out tweaks on that. Now, jumping into the data. Again, I've said this already, but there are more data than just the first two that I show with, and there's some very positives in the data. But as we set up our triage, and as we have said, these are the things that are most important for child welfare and for us to serve children. Those two concepts of safety and permanency have to continue to be our priority. So I want to start with the two data points that we see. Now that's the first tab of the email that we sent out, and it's the last tab, that for no other reason than that's just how our data folks put it together. But what we're seeing on investigations, initiations, and why it's so important that we initiate those investigations is we've gotten a hotline call. We know that there's an allegation of abuse or neglect. We have to make sure that the victims are seen. And so just to kind of give you some statewide perspectives of the data that was emailed out to you, 6 out of the 10 areas are under 70% initiation rate. When you compare that to before this pandemic started, only 3 out of the 10 areas had been below 70%. And frankly, when you compare the percentage differences of those 6 out of 10 areas that are below 70%, we have one area as low as 30%. These went through last Wednesday. If you look at the date, that was initiation rate through April 1st. So if you're saying, well, it's a keying issue, just know that you've had 8 days to key before we pulled this data yesterday. Before the pandemic, the lowest area of initiations rates was 66%. So just to make this very real for you, an area that's, say, let's just use an example, an area that's at 50% initiation rate, that means that 5 out of 10 kids did not see somebody, and someone did not go out there and assist the safety of that kid timely. So, that is super important. And I know that there are concerns about the face-to-face, but I also know that there are ways that we can get creative, use the PPE, use teamwork, and still be able to assess safety. And we've heard from Area 2, who has one of the highest, if not the highest, I think the highest, I don't want to speak wrong, at 89%, they are the highest, 89% initiation rate last week. So almost 9 out of 10 kids for Area 2 were seen within the initiation time rates. And so, and like Sebastian County, who had 17 victim children, 16 of the victim children were seen timely. So we know that there are staff out there that are getting the work done and seeing the kids. So I just want to call that out. Please dig into the data all the way down to your county. There are many counties that are doing an amazing job and had 100%, like, Polk County, they had 3 kids and they saw all 3. But I don't want to go through every single county that I know. I just want to recognize that there are some counties in addition to Area 2 who are doing an amazing job. But I also want to be very real that if you're the county and you dig in and you had, let's say, 19 kids, but you only saw 1, I mean, that's a seriously concerning safety issue. And you need to be visiting about what it is that you need to do to make sure that safety is a priority. Now on permanency, thankfully we heard from Quita, and I know the area directors are gathering information about every county so that we have a better understanding of what's happening with the courts. But what we have been told from a statewide perspective is that the courts are going to be having hearings and they're going to be using Zoom. There are a lot of details to work out, for the courts, and as DCFS, we want to do what's right for kids, which means that we need to partner alongside the court and help them with technology issues. And so I said that at the beginning. So we're going to try, if you have ideas, if you've done something that really works well in your area to help the courts have those Zoom hearings and help them move along, I would love to hear that. Please share that with me or Anna Imbo. We want to make sure that if you're doing it well in your area, that we can share it with others so that we can piggyback off any ideas that you're having. Because court hearings are essential to permanency. Not only are they essential to moving cases forward, they are also essential to actually discharging a kid to permanency, whether it's reunification, whether it's placement with a relative long-term, like custody, guardianship. I can't believe I said custody first. Adoption, guardianship, or custody, or then whether an adoption has to be finalized with the family. So just to give you an overall statewide perspective, last week, going through April 6th, we discharged 26 kids in some form of permanency. Again, that data came in your email. You can look at it compared to the week before the public health emergency. We discharged 95 kids. So from 95 to 26, I get that is really contingent on a court hearing, but we at DCFS need to be advocating and asking for those court hearings and seeing what the barriers are. and trying to help the courts move through those and working with our OCC. And if you do have significant barriers, please continue to message those up so that we can try and help with those issues. So permanency is key. But not only is it discharging kids, again, it is continuing to offer services and supports to families so that even when this is over, they can timely move to permanency. Now, the other data that you saw, there's some great work happening in differential response. We added that tab this time. And see there's less kids because, as you've probably heard and as you're seeing it on your caseloads, we are getting less calls to the hotline. So less initiations, less differential response cases, but the DR team are doing pretty good on initiations there. We're still doing great across the state on first placement with relatives. Last week, 36% first placement with relatives. Great work there. We're seeing great work in foster care and foster care home visits. You guys, I think, are using the technology and making connections with the foster kids, and that's important. Don't get me wrong, that's important. And important to continue to document and Chris. So great work on that. But again, you can't just say, oh, we're doing an amazing job in foster home visits. We can't forget to focus and come up with a plan on those investigations, initiations, and completing investigations. And then monthly in-home visits. So improvements from last week. I want you to really dig into the data on your in-home visits. Like I always tell you, that's our most vulnerable population, and sometimes we provide the least focus on our in-homes. But honestly, that is our most vulnerable populations. There has been a true finding for a maltreatment. We have left those kids in the home, and man, Kim Sewell and Krista down in Hot Spring County, when they shared with me the work that they're doing on their in-home case, I was just blown away. There were several families that they talked about that are really borderline, and you guys have them across the state where we've left them in the home, but it was really a question of can these kids safely remain in the home? And the answer is they can safely remain in the home if we continue to get out there and see them. So if that's the logic that you had prior to the public health pandemic, those factors probably didn't change. So continuing to either get out and see those families or making sure that you're assessing the safety via video conferencing. But those are going to be your hardest cases because some of those families are going to continue to need face-to-face contact. Again, it's an individual case-by-case assessment of whether you need to be there face-to-face or whether you can do video conferencing to truly assess those families. If we don't continue to work with those families and offer services, those children, some of those children will end up in foster care. So just making sure that that is a continued priority. So now I'm going to turn it over to Becky Dunnigan. She is, going to use technology. And so just hang with her for a second because this is her first time to show you safe measures on a Zoom at the same time talking. So a little stressful here, but yeah, she got kicked off of safe measures. So she got to log in real quick. But really this data that we're pulling once a week, for the most part, you'll see as she logs into safe measures, this is data that you can pull down to your workload daily, and it is updated nightly. And we really have worked with our champions to make sure that this is user-friendly, hopefully even more so than Chris, so that you can use it. Again, Kristen Harper is working with our field trainers to see if we can offer some additional guidance and support on safe measures if you're not using it and need some support. Okay, so Becky's in, and hopefully the screen is shared and everybody can see what Becky can see.
Hello, everyone. So I'm going to go over some quick safe measures tools that we can use. I'm going to then quickly log out and log back in as a demo to show you my coming work with a family service worker. So also, I want to just say that there's a core team out there that's having regular meetings on safe measures, and we are counting on you too to go into your safe measures, do some QAing of it. If you're wondering why something is not counted or something looks different, you go straight up here. We'll see where this says contact us, straight up there. Click it, email straight to the Safe Measures team. And if you can give them a case number, they'll respond back. I sent them many emails yesterday on a couple of things, and because I looked at the safe measures and then I went and looked at Chris and questioned some things. And there were a couple of things they were like, this is this was this was not documented correctly. So that is why it's good to use your contact us and have communications directly with Safe Measures. So main menu. What happened?
It's just thinking. Just give me a
Okay,
second.
here we go.
Patience.
I am going to start with timely initiations. So click on the timely initiations. This is going to come up and show the timely initiations graph. As you can see, this is, we're coming down on timely initiations. Now this view tells me contact not timely, attempted, involvement after started, contact found. I'm going to go up here. I like to use this compliance view, and it's only going to tell me if a contact was found or not found. And again, if you look at the graph statewide where we are, then we have decreased. You can go up here and change the time frame. Let's look at a month to date. This is going to be all of the investigations that have come in. This was refreshed nightly last night. So this is going to be all of the investigations that have come in just for April. So, and I know what you're thinking as well. Some of them have, it's only been 24 hours and it's not even the initiation time yet. But again, this is a way to look at your work and to manage your work and see what's coming up. So let's then go to the comparison. And again, I am still on April. This is what is, can you see up here? These are the investigations that have come in just since April 1st to April 7th. So here, if you look, this is the comparison. This is all of the counties, and then we have some statewide here as well. That's our number, area 11, so you can ignore that. But look here, area 8, even through April, you're already at 82.9%. And some of these aren't even needing to be initiated yet because your 72 hours hasn't expired. So good work. Area 10, you've already initiated all of your April. You're 100% in just your April initiation. So if we looked at area 8 and you want to go drill down, click on area 8, and we're going to drill down further in area 8. It's thinking, here we go. So then if I wanted to look at Craighead County, I could drill down further into Craighead County. Then here we go, we're in Jonesboro. That's Craighead County. Click on the Jonesboro, drilling down further. This is the supervisor that supervises investigations. Click on that supervisor, drill down further. And here we are. Here we are with the staff that have investigations since April 1st, just this April 1st to April 7th. So you can look at this staff and see and say, we're going to go and we're going to drill down further into this staff person. So we can look as a supervisor, you can look at this and you can look at the investigation that has not been initiated yet. And so you can drill down to that and look at that. If you wanted to send this in Excel right down here, or you see them right here, you click on that and that goes straight into Excel, and that will go into Excel quickly, easily, and then you can share it with, you could share it with the worker, you could share it with the supervisor if you were an area director looking at this. So I want to go to a couple other tools in Safe Measures. Okay, I'm going to now go to, let's go to foster children, monthly visits to see foster children. Now, if you look up here, notice I'm back to March. Again, if you want to change that time frame, you could, but let's stick with March here. Statewide, if you look at this, I'm going to go here again. This gives you what we're looking at on the graphs right now, which is contact found, contact not found, entered and exit this month, runaway. But if I want to just go strictly to compliance, I go right up here, check that. And if you look at this, as far as foster children statewide for March, we're actually doing a little better than we were in February. So great work out there. So again, we can go to the comparison, and this is going to show all 10 areas. Here we go, looking at all 10 areas here on foster children visits. This time I'll just drill down to area 6. This is for March. So you could go look at this because you could see if truly these the foster children did not have a visit or if it just hasn't been documented. So this, again, you could go into this, continue to drill down. Let's just use Jacksonville. You could continue to drill down. And continuing to drill down, that was the 2 supervisors that had foster children under them in Jacksonville.
Just be warned, if you on a DCFS all, we might feature your work all the way down to your level.
So here, so you look at this then, you know, if I was the supervisor, I would be looking at this, and you can continue to drill down and
But guys, as it's coming up, you know, even though these numbers are very useful, and this is a great way to manage, but of course we're also saying dig into the reasons behind the numbers. You know, sometimes there's very valid reasons that a number is not 100% or not whatever percentage that you want. We're not asking you just to make the number a certain number. We're asking you to manage to make sure that you're getting down to this individual level, which is why Becky is showing it, so that you understand what is happening behind the number and that you're properly addressing a particular issue or working with that particular child. So I just want to make sure that we're always making that point.
so if you look right here, what I did is I sorted that. So all of my cases without a contact found are here. So again, you could look up each of these cases, see what's happening, have a supervisor conference with this staff, figure out what's happening. Is it just that it is documented? Is there some, you know, strategies that they need your support on? And again, down here, you can go ahead. I'm gonna go ahead and do this. I'm hoping it doesn't kick me out, but I just want to show you how quick it is. If I was a supervisor, I could, it didn't work. I don't know why. I could export that. So I'm not sure why that didn't
Go back
work.
to the tab. Put you in a new tab. So go to the second tab.
Yeah.
There you go.
Yeah, I don't know what happened there. So I don't know why that didn't export. Let me try it one more time.
It may be because you're on my computer.
Yeah, it may be because I think it is. I'm on Misha's computer. But if you go over here, this exports it really quickly. Now there will be 2 tabs at the bottom. This is going to show exactly what you're seeing on the screen, so you can really easily send it to whoever you want to review or have a supervisor conference with about it. Or if you're the worker, you want to send it to yourself and look at that so you can pull up your individual cases. But I'm going to show you my upcoming work, which would be better work for that. But there's a second tab on the Excel spreadsheet that just gives you a summary of what you're looking at.
Yeah, and we got about 11 minutes, Becky. So you want to go to the upcoming work?
Yeah,
I want to take a few questions.
Yes. Okay. So so again, I want everyone to be looking at this main menu, going into these cases, drilling down just like I did, and looking at that. We really need you to look at some of these tools and drill down. And remember, go up to the contact and email Safe Measures team so they can help you if you have questions about it. So I'm going to log out so I can log in as the demo for the FSW and show you my upcoming work, which is a great way for an FSW to manage their work.
No, your keys are on the wrong place. There you go.
Okay, my upcoming work. This is a demo, even though it is truly an FSW's workload out there in the field. It is under demo and it doesn't have their name. So here we go, my upcoming work. As an FSW, I can look at this, and this is showing the monthly contact needs to be made. There you go. There's a monthly contact due in April and it hasn't been made yet. But it may be that I'm like, oh, I think I went to see this family. Let me go back. I just haven't gotten it documented. So this is going to be a way that you can manage your work as well and keep up with, because I know what it's like out there, and it's like, trying to remember if you documented this home visit, that home visit. This is a way for you to go back and see that, oh, I must have forgotten to document this. So here, again, some good work being done. Already documented the April visit for that family and that family. So see, if you see, it says next one due in March. Next one due in May. Now, we all know that some of these families need weekly visits. So it's the family and the child, like Misha said, behind the data. So your case is better than we do. So this is just a guide on monthly visits. It may be that this family needs weekly visits or twice a week visits. So good work there. And then there's the case plan and the cans and the staffings due. So this is a very good way as an FSW to manage the work. And again, I don't even know whose workload this is, but good job, because there's already been a lot. You see the greens, already been a lot of work done in this short time in April. So I'm going to log out of that, and please use your safe measures. Go in there, drill down. I am available. If you want to email me, I will help you through safe measures. I know, like Misha said, Kristen's working with Mid-South to do some additional training on safe measures. And we have an awesome Safe Measures core team members. So reach out to your Safe Measures core team members that are across the state.
Okay, so we'll open it back up because it's really important it's really important to me that I answer your questions. And so today we're going to take questions through the Q&A. So there's not a chat box, because last time it got a little confusing that there were a chat box and a Q&A. So go into the Q&A and share with us on Q&A. Ask me questions or share what you want to share, and we'll take the next few minutes. I'm seeing already somebody close their first case via video hearing. Yay, absolutely. Thank you so much for sharing that. The cleaning people in the local offices don't use antibacterial soap when they supply for the county office. Can this be mandatory in their cleaning contracts? Are we buying our own and bringing it to the office? Can you get with, I don't know the answer off the top of my head, and so I'm not necessarily super familiar with the contracts. Can you get with the county administrator and see what the county administrator tells you? And then based on that, will you email your area director or your county supervisor and let them know? And then they will make sure that they share that with me, and we will link up with the people who do manage those contracts over at DCO. So, but get with your county administrator and see what they say first.
So Misha, is this also where I know at least area 8 and area 9 and maybe some other areas found Lysol wipes out there? Misha had given permission for the area directors to buy the Lysol wipes to use in the office for the staff. And I know we heard from area 8 and area 9 that they found Lysol wipes for each of their county offices last night. I found some at Lowe's, and I think area 8 and area 9 found theirs at Walmart.
Now, I need y'all to coordinate, especially in the big offices, and not everybody who has a P card goes out and buys disinfectant, Lysol wipes or whatever. So please make sure that your county if you're a county supervisor, you need to be lead on working on how you buy, or like who is buying and how you buy. I mean, I get that maybe, whoever's out there, if they see it at the Dollar General store, they buy, and that's fine. But don't buy enough to last 5 years. Like, let's be responsible about the purchases. And county supervisors, please be lead for your county on making sure that we're responsible and not buying for a whole army if you come across a pallet at Sam's too, So, but I want you guys to have the Lysol wipes and have what you need. So we are allowing the P-card purchases on that. I can't access safe measures. I get the message your IP address has not been authorized to view this content. Please know that if you're working remotely, you either have to remote desktop in, or you have to use your VPN on your laptop, because you have to be on the network just like you do for Chris to access safe measures. If that is not the answer to your question, please, who do they need to get with? Do they need to call a ticket in?
They could just email me.
Email Becky. So if you've tried, you're either remote desktop in or you're on VPN, it's still not working. Get with Becky, and she will make sure that somebody supports you on the safe measures. I have people under my unit that are not correct. How do I get this fixed? I assume we're talking about PGCS and performance evaluations. You can email Stacy. Please also note that Amy Webb sent out an email saying that the timelines that you previously received are no longer in effect, and that you'll need to wait to get some additional guidance. So right now you are not entering PGCSs, and there was an email from Amy Webb yesterday regarding that. But again, if you have the wrong people under your E's, you need to email Stacy with an I Miller. She's our HR person.
So Misha, were they talking about ease, or
Oh.
they might have been talking about safe measures?
Oh, okay.
Yeah, there is a glitch in safe measures, and we're working to solve that, where there's others showing up that shouldn't be. They're in the wrong county. Or I'll just use an example. I pulled up Area 8, and every county in Area 8 is showing but Clay. But they are working on fixing that. If you were talking about safe measures.
Yeah, so we have some expanded questions to triage, responding to provisionals after a local situation last night. I'd be happy to share with those. Lori, please do send those as well to Lacey Lawless, our foster care manager, Becky, Megan. Include all your chain, including Jetty and whoever, Jamie Renna. She's already sent it to you?
No.
Okay, So, but let me just call, I don't know the situation, Lori, that went on, but let me just say, since I'm on a DCFS all related to provisionals, that initial in-home consult on the relative, that needs to be face-to-face. Just like with kids, we can't really assess somebody for the first time without actually seeing their home or seeing them. So those are going to still be face-to-face. I have no idea if that's your question or not, but we do want to support you, and it seems like it might be too complicated for the Zoom. So just reach out to us all the way up the chain, and if we need to set a conference call to get your questions answered, we will. And for the rest of you who are like, but I want to know what happened with Lori, based on what we get, if there's some new guidance, I promise we will follow back up with them. Anonymous, can we get the licensing review board done by Zoom during this time so that kids can be moved quicker into these homes if they are approved? Okay, so not necessarily, I'm gonna answer your question, but not the way you probably want, which is, Sandy Doherty is working to get temporary approvals. There are very few that actually have to go before the board. So unless you have one that's super controversial, yes, we could ask for a board, but for the most part, I need you resource to work with Sandy Doherty, who's working with the licensure board to get temporary approvals so that we don't have to go before the board. If we get a temporary approval from the board without a hearing, we can go ahead and make placement. There is one that I know of that is waiting for the board to hear, but I am only aware of one in which the actual board wants to hear it, but we're still working with licensure, and it's in my hands. So if that's from Area 8, that one is in my hands, and I need to regroup with Sandy and you guys.
Hey, I will take the one about resource workers on safe measures. So you have a champion out there, resource workers, and that is Tracy Holloway. She is part of the Safe Measures core team, and so is Tiffany. And even though Tiffany's moved into a different role, Tiffany and Tracy Holloway are lead on resource work in Safe Measures. So I am certain that Tiffany and Tracy would be glad for you to email them, but they are working on a lot of new tools for resource workers in Safe Measures. So stay tuned. That is one of our priorities coming up pretty soon, is resource work in Safe Measures.
Yeah, so Union County got Gloria Billingsley's sister to donate masks. Great job. That's awesome. Thank you for sharing that good news. Lori, I see Lori's posted something else. Lori, we're gonna get with you. Deborah Key, will we be provided more than one mask to wear when we are out in the field? So all the PPE that we have currently been provided has been distributed to the field. Again, as I mentioned, we are continuing to advocate for more PPE from the state's resources, but we are also exploring more options for PPE. If you have like massive quantities of PPE, we are really trying to get PPE to you, and as soon as we have more specifics, we will get that to you.
But I think this is where having the cloth mask made and seeing if you can get cloth masks will help as well.
Absolutely. But again, we'll continue to try and get additional PPE in addition to those cloth masks. Thank you for allowing Zoom and micro teams on our phones. That was a little bit of a struggle in the beginning. Thanks for sharing that. We want to hear from you if you have technology options that you think would work, or if there are technology that you're using that is working really well. Please continue to message that up so that we can share with other DCFS across the state who still might be struggling. An anonymous, should all employees wear PPE while in the office? Here's what I'm going to say about that. We haven't provided you enough PPE to be using it 100% all the time. So just like you're triaging priority, I would triage my PPE use for the most high risk situations, and then figure out how to work with community partners to get cloth coverings for the rest of the time. So the CDC has said use the cloth coverings when you can't social distance. So if you're not able to office, you know, I brought a bandana, it's up in my bag. I haven't actually put it on yet, but I'm thinking about it. So you know, maybe it's just a bandana that you wrap up and put over while you're in the office, especially if you can't. I've been kind of quarantined in my office for the most part, so I didn't feel like I needed it. But if you're in an office where maybe you're still in close proximity, maybe you don't use the PPE that we've handed out to you, but you are using some kind of bandana, cloth covering, getting with community partners for the main mask. Another anonymous, shouting out to all resource workers. Area 7 has been giving foster parents options to face-to-face visit or another method, which letting them we are all a team and we care for the families. The call in Lonoke County are supporting families by gifting different items the family might need, especially if they can't get out and about. That's wonderful to hear. Thank you to Area 7 and to the call.
So Wendy, you said that it was the safe measures. Can you go ahead and just email me more details so I can make sure that I think it's part of the same issue we've been having in safe measures with the county not showing up or workers showing up under the wrong supervisor. But if you will email me, Becky Dunnigan, I'll work through that and make sure it is the same issue.
Becky, take Sarah Moore's question, please.
Okay, if there are multiple.
They can't see the question, so you have to read it.
Okay, if there are multiple of the same clients in Chris and the clients are not merged, that would cause a problem in safe measures. That's correct. That causes a problem even in our ChrisNet reports. That causes a problem on core. You all know that. So we really need to keep those client screens cleaned up. And that would be even the way it's pulling from core or ChrisNet, some of the reports, as well as safe measures.
So sometimes I can't tell who's exactly sending this because I just get your DHS login. So sorry if I didn't share your name, it's because I can't exactly see who it is. But I don't have a question, but a statement. I enjoy greatly safe measures. It's helped me so much. I don't use it daily, but at the first of the month and the end of the month, love it. Thank you for sharing that. And Sherry, there are a lot of Arkansas families struggling without food right now. Can you ask the governor to mention the DR program in his press conference so that people needing help might be able to self-refer and self-get out help? I will definitely refer your food statement to leadership and see if that gets to him. Lori, we are doing all provisionals face-to-face. I suspected you were. But I just wanted to put that out for everybody else. And thank you, Lori, and to your team. I know y'all always do great. And Lori gives a shout out to Tracy. So I'm not sure which Tracy.
Tracy Holloway.
Oh, Tracy Holloway. Okay, great. Thanks, Tracy. Here's another anonymous. I don't have a question, but I'm so proud of the resource workers still going out and meeting families in person to set them up from provisionals and on-call and normal work hours. Don't feel like resource gets enough praise. So maybe I haven't praised resource on this Zoom, and I apologize for that. But you guys, I have been giving you lots of praise to everybody I talk about. I am a huge advocate for how important it is that I know how important for kids it is that we place with relatives, and how important it is for our overall system that we make placements with relatives. And that work has been done because of resource the last 4 years going on call, really assessing the safety of the relatives, not just whether their home is appropriate. So I am a huge resource resource worker fan. I think y'all are key and vital, like everybody else that is working in child welfare. So thank you to all that you're doing, in addition to everybody who's making face-to-face contacts.
And the data on first placement with colleges, a huge part of that is the resource staff that's making that work. And again, Misha talked about that data earlier in this Zoom, but yes, kudos to the resource staff getting out there and making sure the homes are assessed and, if appropriate, open so children can have their first placement with a relative.
Area 1 had cloth masks donated. Great job, Area 1, and thank you to whoever that community partner is. I know that we're over time, but I'm just loving these. Hey, I got a really great question about reevaluations on foster homes. We're going to copy and paste that because that is on my list of things that we really need to make some decisions about and some input about. So for Mr. or Mrs. Smith, who is asking me that, we're going to hold that one, and I'm going to come back and we'll either put out a message in writing or otherwise about reevaluations. Will they be doing Zoom foster parent classes, as we have people that need to get their classes done? I believe those are, the call did 233, and my understanding is that Mid-South and our contract partners are doing those. So if you haven't heard about that, and because you are anonymous, I need to hear from your area the specifics, but we are trying to use technology to move people through the system. I'm going to move on down to Dodd. Can someone paste the link to the new sew cloth mat? Yes, we are going to send out an email that can be sent to partners, and it includes a link to the pattern for face mask. Another shout out to resource workers and on-call workers going out in homes. Thank you. Yes, absolutely. Somebody who wants to continue to have the Zooms routinely, absolutely. We plan to do that. If you have topics or questions that you would like us to cover, please share that with us. We want to make these relevant for you all. With schools being out the rest of the year, what does that mean for our remote workers? Okay, I love this question. I am a mom of 2 8-year-old twins who I am trying to survive AMI remotely. And a lot of the leadership team is up here. It is a nightmare. I would like to paint a pretty picture. I also have support from an amazing husband who is also helping our children on this AMI. It is a lot. So please, we need you. We need you to continue to work and manage, also working with your children on that AMI. You can take sick leave if you need to take a few hours to help your kids, or if you need to take time to help your kids through the AMI. It is a real struggle. I am hoping that as my kids get more in a routine of what they do electronically, that it will get better. I hope that you have support. Some of you do, some of you do not. So it's going to be hard. Your family is your priority. So we want to help support you in that way, but we also we need you. So we need you. We need you to protect the children across the state. So hopefully we can find some balance and we can be a little bit flexible with hours and with your supervisor to make both work.
Hey, I have 2 names on my safe measures list that have been there almost a year. I mentioned it in training, and they were going to look into this. Can you email that to me, done again, please?
The PGCS questions, you know as much as I know as far as PGCS and evaluations. Really, you do know as much as I know what Amy sent out. I think that there is still decisions to be made, and as soon as I know, I will let everyone know. Absolutely, on-call workers get amazing praise from me, and again, if I haven't given them enough praise, on-call is super tough. Our resource and our investigation and we have foster care teams that do on-call too. Amazing work. Thank you for all you're doing. So I think I've kept us over long. So if we can just scroll down and make sure, I'll take just one last question. I'm sorry I'm not getting all of them, but I just want to see if I'm not missing something super important. Oh, somebody says the DCO County Administrator is demanding masks in the office. If it's actually truly PPE and not a face cloth mask, like if it's not, if you can't even get away with a bandana, can you please email that up so that gets shared? Yeah, I see somebody say, oh, Kristen, thank you. Kristen is saying Mid-South is doing pride trainings via Zoom. Kristen Harper said that. So if for some reason you in your area have a foster parent that you don't think is moving forward because of a training issue, I need you to email that up and include Kristen Harper so we can figure out what's going on there. Yes, this is, oh, sorry, you can't see the question. Somebody asked if it's recorded. It is recorded. So as soon as we get the link, we can share that if there are others that are not able to see this. Just scroll. keep scrolling, keep scrolling. I'm just trying to make sure I hit any major issue before we get off. Somebody doesn't know trigonometry for teenagers. I have complete sympathy for you in this AMI work, trust me. Okay. I know that I've received several questions about hazard pay. At this time, there is nothing in the works related to hazard pay, but it's not a complete no forever. Just at this time, there is nothing in the works right now at DHS. The focus is really on trying to figure out pay related to the state hospital and to the health center. There's discussions about it. Right now, there is nothing in the works related to hazard pay. Can you clarify what you just said, talking about sick leave to help their kids on AMI work? Would that not be annual leave? Okay, so here, thank you for that clarification. If you'll remember, what has been said is that if you have a child care issue because the schools are out, that you can take sick leave. So basically what I'm saying is, if you have a child care issue because the schools are out, and that child care issue is that your child is sitting at home and needs help with AMI and you need to attend to that, I am interpreting that you have a child care issue. You have a child care issue because the schools are out, and the guidance has been that you can use sick leave.
One more. You want to say Sherry Rogers? I think
Oh,
that's
Sherry Rogers.
that'll be
It's
helpful.
scrolled up. I don't see it now.
Don't forget,
Yeah, go ahead, Becky.
don't forget to tell them about the KHAN Khan Academy tutorial. It's great for all grade levels and subjects. So it sounds like Sherry Rogers is giving us some information on tutoring.
And it's free. She's saying it's free. You know, Sherry Rogers is our education liaison and expert. So thank you for bringing that up, Sherry. Okay, so we really got to go. We can copy and paste all these questions, and I'll go back through them and try and make sure that I didn't miss anything. I apologize if I missed your question, but we will try and follow up on all the questions that we missed. What I also missed is like I don't think they can't see the question and answer, right?
Yes, ma'am.
They can. Okay, good. So I hope that everybody saw all the shout outs for the great work that's happening across the state. I recognize there's amazing work happening across the state, and I love that. I love to see all the positive comments.
So I want to answer one more. Is everyone required to turn in time increment sheets while working remotely? I can just tell you I'm working remotely, and I'm doing my time increment sheets and on a Word document for Misha, since she's my direct supervisor.
Becky has not worked remotely very often, and I've done 2 days so far, and I have done my own daily tracking sheet as well. So we are all the way up to me if we are not in the office doing daily tracking logs. And honestly, that's to protect myself, and it's to protect you if there is ever any question about whether you got work done. Remember, it can be high level, because if your work can be tracked via email, we know what phone calls you're making. So just keep the log high level. If you are in Chris, or you're on your email, it can say emails from 10 to 10:15. You know, we can then, if it's ever questioned, actually use technology to monitor whether you are actually on your emails or on your phones or on Chris. So keep it high level. Don't waste a ton of your time, but it's a protection for you, as well as good information for your supervisor to help support you in the work that you're doing out there. So thanks you guys for all that you do. I'm sorry that we kept you over an hour. I hope you found this time beneficial. I want to hear from you if you have questions or concerns. So if it's something very specific, please get with your supervisor and feed it up the chain, but it's very systems oriented and you'd like to reach out to Becky or I, we would love to hear from you. So thanks you guys for all you do. And a shout out to every single staff that works at DCFS. You are critical to the children and families across the state and are doing amazing work. So thanks you guys.
Thanks,
See you
guys.
next week.
Bye.